So before we dive a little deeper into metastatic disease, two of the abstracts in the colon oral session in 2015 ASCO are about, the role of vitamin D levels and the role of aspirin. And I will confess that I don't measure vitamin D levels in my patients at this point because I don't really know what to do with them. And some patients ask, so I measure. But then aspirin is one of those things I've been having all of my, colon patients in the adjuvant setting, certainly in long-term follow-up take. What's your all's take on this information, both suggesting an improved outcome for the highest quintile of vitamin D and aspirin takers? Dirk, what do you think?
Yeah, the aspirin was looked at in stage 3 disease, whereas the vitamin D was looked in stage 4 disease. Both showing more or less what we were expecting. Yeah, that first of all, aspirin takers in stage 3 disease have a lower chance or a better chance not to die from a cancer-specific reason. And the vitamin D says patients with best vitamin D levels do better in metastatic disease. This is not unexpected, but I think the consequences should be that we need more trials, at least for vitamin D. As I understood, it is in planning. Yeah. With aspirin, I'm not sure.
So we have in the U.S., the 3 versus 6 month study has a plus minus 3 years of celecoxib, which makes me nervous that we may find out that celecoxib is positive and then we never go back to a penny a day for aspirin. So I do worry we'll be stuck with that positive. So patients with colon cancer probably should be taking an aspirin. The vitamin D story to me, is this just people who get outside more and exercise and have a better,
very likely
versus some metabolism in biology? Is this a predictor of good performance status, for example?
Yes, basically. Yeah. With aspirin, actually, my question is, what about if the person has a very good diet that is taking out all the risk factors for developing a new cancer? And how does this change the risk versus aspirin? Because also our tendencies that we will make a use of medicines for preventing everything. That can be a risk that we are taking medicine. So in this country, for example, a lot of people take vitamin supplements for everything since they are very young.
Yeah, I take bourbon. That's my vitamin supplement. It's got everything in it.
And aspirin?
And asprin. That's my aspirin.
At the same time. At least you have no headache. This is just...
Yes, there are a lot of supplements that are taken in the United States. That's true. More than our medicines.
Maybe the Mediterranean diet that we had in southern Italy could be an answer to that.
Yeah. All right. So...